Hello, my diet tribe. Welcome to my channel. Let's talk diabetes with Nkirika. Today, I'll be discussing diabetes and women health. For persons living with diabetes, especially if your blood sugar has been left uncontrolled for a very long time, problems can manifest in your sexual health. These problems can be seen in both male and female individuals living with diabetes. But my focus today will be on women and sexual health. Sexual problems can happen to anybody, whether you live with diabetes or not. But women who live with diabetes are at a higher risk of developing sexual dysfunction. This is one of the secondary complications that come with prolonged unmanaged blood sugar levels. So, how does this happen? Prolonged uncontrolled blood sugars can damage the blood vessels and nerves that supply the sexual organs. This restricts the amount of blood flow to your sexual organs, and consequently, you lose sensation. This impacts negatively on sexual arousal. So, the different problems that can be seen in female sexual dysfunction include: one, dryness of the vagina. This is quite common in women, like I said earlier on, who have uncontrolled blood sugar levels for a very long period of time. This results in lack of lubrication in your vagina. This is due to damage that has occurred to your blood levels by the uncontrolled blood sugar levels. And this most often leads to painful sex and reduced stimulation. And to help out with this, it's you can get prescription from your healthcare professionals, or you can go see the pharmacist over the counter and get some lubricants that can help with vaginal lubrication during sexual intercourse. But the end goal is keep your blood sugar levels in the target range all the time. The second thing that can be seen in women with uncontrolled blood sugar is thrush. Thrush is really common in most women, and it's a fungal infection. Point of note, thrush is not sexually transmitted but can be passed on to your partner during sex. And living with poorly controlled diabetes makes you more prone to getting thrush. Most organisms thrive better in in a sugar-based environment. So if your blood sugars are uncontrolled, your vaginal health will be at risk, because when you pee, you're peeing out excess sugar, and these microorganisms feed and thrive better in that sugary environment. So it's kind of like a perfect breeding ground for microorganisms. So, like I said before, you need to keep your blood sugars in target range to reduce your risk of getting thrush. And the common symptoms that you would notice if you've got thrush is having very itchy and painful vagina. And when you pee, you feel this stingy sensation. And during sexual intercourse, you find out that it's quite painful. And then the third most common sexual dysfunction that we see in women who live with uncontrolled diabetes is urinary tract infection, popularly known with the short acronym UTI. So this is common with all women, but women living with diabetes, your risk of getting a UTI is a lot higher. And the sugary environment also promotes bacterial growth, and symptoms that could infer that you probably have a urinary tract infection include pain during urination and pain in your lower abdomen, and you feel the need to pee more frequently. So, point of note, just keep your blood sugars in the target range always, maintain good personal hygiene, and if you notice any of the symptoms I have mentioned much earlier, speak to your healthcare provider, and they'll help you get it all sorted out. Please like, subscribe, and hit the notification bell to get more notifications of more interesting videos from Let's Talk Diabetes with Nkiruka. Bye and have a good day.